It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
And welcome to U of L Today with Mark Hebert on 93.9 The Ville. Glad you're joining us tonight for a show that's about all things University of Louisville, all the good stuff going on at U of L. If you want some good news, find out what's going on at U of L, you found the right place. All right, so on the show today, U of L has been working on a major study of ADHD in kids and how to temper that in a school setting. We've talked with researcher Andy Frye from the Kent School of Social Work before about this study, and we'll get an update on his findings. But first, we're going to be having a new segment on U of L Today with Mark Hebert, sponsored by U of L's longtime partners at Passport Health Plans, the nonprofit managed care organization that administers Medicaid benefits to Kentuckians. Better Health Together is what we're going to be calling this segment over the next few months. And the first guest is the boss at Passport. His name is Mark Carter. He's the president and CEO. Welcome, boss man. Good to see you.
Thanks for having me, Mark.
Just so you know, I've known Mark for quite a while, so I can call him the boss man and get away with it, right? All right. What is Passport, Mark Carter?
Well, you just described it. It's a Passport essentially is a health insurance company that covers people that rely on Medicaid for their health insurance coverage. And although I don't like to think of us as a health insurance company,
probably that's not a good moniker to have probably these days.
Yeah, it's we're more of a care coordination entity. Basically, what we try to do is to understand the health and the health status of our members and then get them the treatment they need in the right setting. So we coordinate whether they go to the physician's office, the hospital, et cetera.
So you administer the benefits, but you also do the other stuff. You coordinate the care in some cases.
Right. And our, the mission of our organization is to improve the health and quality of life of the member. So we take, the funding from the state, and then we use that funding to try to have a positive impact on a member's health.
How many people have Medicaid benefits through Passport?
We have about 320,000 members at Passport, about 200,000 of which are here in the greater Louisville area. And there's about 1.1 million people statewide that are eligible for Medicaid. So we're one of 5 plans that operate in the state.
Okay, and so 2/3 of the folks you have are right here in the Louisville area,
that's right.
Basically.
Yeah.
And those folks, when they use Passport, do they have like a card or something, or how does it work that they interact with Passport?
They do. They have a membership card, just like someone who had Anthem Blue Cross, and they'll present that to their physician when they go to the physician's office or to the hospital if they have to go to the hospital. It's very much like any other insurance plan.
All right. And we got Passport Health Plan on a U of L show, so I guess we ought to explain what role U of L has played in the history of Passport Health Plans here.
Right. Yeah. Well, U of L's been integral to Passport. Essentially, the plan was founded about 20 years ago by the physicians at University of Louisville in the medical school. At the time, that group was led by Dr. Larry Cook, who was the chair of pediatrics at the time. Medicaid was very much focused on women and young children back in those days. And, if it weren't for the University of Louisville, Passport wouldn't exist. Today, we have 5 what we call corporate members. We're a nonprofit organization. But 2/3 of the corporate ownership, if you will, of Passport is held by the U of L physicians or the university hospital combined.
So it's a big player. U of L's a big player.
Absolutely, a critical player.
And when you say that they're not the owners, that's not the right word. What do you call them? Partners, I guess?
Yeah, we call them sponsors. But it's the term of art in the legal circles is a corporate member, because it's a nonprofit organization.
And so they're kind of the governing board, for lack of a better term?
That's right.
That a fair assessment?
That's right. There are 15 members of the board. They, of the sponsors, appoint 9 of the 15 members. So effectively, they own Passport.
Right. Let's talk about some big changes coming up in the way that Kentucky Medicaid is being administered, I guess, to the folks who get Medicaid benefits. Talk about that a little bit and how Passport fits in trying to get information and to these folks that get Medicaid benefits about how the changes are going to be coming down the road here.
Right. Well, the major change in summary is that, and this has received national attention, is that for a certain class of member that gained coverage under the Affordable Care Act or Obamacare, those members will have some requirements placed on them to pay pretty modest premiums participate in volunteer community activities, job training programs, and the like. And the fundamental thinking behind that is to try to help people develop skills and become employed. The challenge with it is with this particular population, there's a lot of reporting. Some of the co-pays and premiums could be challenging because these are folks with limited income. So one of the things that we're doing is we're working very closely with the state to make sure that we understand all the requirements, that we get those effectively communicated to our members, our portion of the membership, and then we have about 25 folks working for us that will be engaging directly with the members, talking to them on the phone or in person to help them understand the requirements and remain eligible, and to connect them with job opportunities and community engagement opportunities that might help them build their skills and ultimately get off of the Medicaid program.
Right. We're talking with Mark Carter, who's the president and CEO of Passport. The segment's called Better Health Together with UofL and Passport Health Plan. These changes, how many folks will be impacted by these changes, just out of your group? How many Passport customers, for lack of a better term, or members are going to be impacted?
Well, we estimate that about 60,000 of our members would be subject to these rules. So it's not the full 300.
Or they'd have to pay a co-pay or a work
right.
requirement or something like that.
Yeah,
right?
That's right. It's and it's actually probably a little bit north of that number. We believe that at least in our business planning, we think we will have some attrition of membership, and we budgeted for that. During the second half of the year, about 20,000 members.
So you think you're going to lose 20,000 members because of this, just because people can't handle the paperwork, or? Yeah,
it's it's a guess, Mark. We try to make our best guess at it. We're hoping we don't lose any, and our focus is going to be try to make sure that that's what happens. And yet, at the same time, there are some pretty significant requirements and lockout periods, and I think even the state policymakers at the time they introduced the waiver anticipated some attrition as a result of it. So that's kind of what we think might happen for us, but we're doing everything we can to make sure that that's minimized.
Right. So you're talking about some small co-pays,
premiums
for some folks,
right?
Work requirements or volunteer work for some of the folks.
Yeah,
they have to be able-bodied, though, right?
Right.
A person
that's right.
who's disabled, children, those folks are not covered.
That's right. Mothers, children, folks that are disabled, sort of the traditional, what we call the traditional categories of aid. Mm-hmm. Those folks aren't really impacted by it. It's generally the it's the population that gained coverage under the Affordable Care Act,
right.
And there's a subset of that population considered able-bodied under the waiver.
And just to be clear, you guys didn't have anything to do with the waiver or the policy. You're just administering it. You're just carrying out the edict, right?
That's right. Our we're essentially the state is our customer, and our job is to carry out the policy that they put into place.
Okay. And what would you like those folks to know right now that may be listening, that may have Medicaid benefits, that do have Passport? What would you like them to know?
Well, the primary thing is to get educated about it. There are all the plans have websites. The Department for Medicaid Services has a website. There are 800 numbers. I don't have the 800 number with me, but call.
Oh, I actually do.
Ah, okay. So, but call, get educated, get on the web, take a look at the requirements, and make sure that you understand them, so you can play your role in keeping your coverage in place and your family healthy.
Yeah, and just all of a sudden here, and it takes effect July.
July
right?
1st.
Okay, so come September or July, September or October, and you suddenly walk into a doctor's office and you can't get benefits. You've been kicked off benefits.
That's right.
Don't panic then. Do your homework beforehand, right?
Right.
All right. That 800 number, by the way, is 800-578-0603, or you can go to passporthealthplan.com on the web. Mark, you've got, I assume it's an exciting new development at Passport Health Plan. You're moving downtown, or the West End, actually.
We're moving, well, and I see it as we're moving back downtown, although, as you say, it's the West End, about 9 blocks west of 9th Street at the corner of 18th and Broadway, the site of the old Philip Morris plant, where we intend to build a corporate headquarters building and develop a health and wellness campus. So We'll go from making Marlboro cigarettes at that location to trying to promote better health.
How many folks do you have working at Passport at the headquarters?
We have right now in our current building, we have about 500 people working for Passport. There's probably another 50 to 100 that work remotely. We anticipate through a partnership that we have with a company called Evolent Health that the employment at that site at 18th and Broadway could grow to 700 to 1,000 people in the next 5 years.
Oh, really? So you're going to have some subcontractors in there? Or what?
Well, we have a strategic relationship with a firm that is helping to develop other Passport-like plans in other states that we've created a partnership with, and they'll have their national headquarters in that building. The building is 4 stories, 300,000 feet. It's about an $80 million project. It's easily the largest investment in West Louisville in 60 or 70 years. And then in addition to that, Mark, it's not just the headquarters building, but the concept that we're trying to create is essentially a density of social services that have an impact on people's health. So an example would be safe housing or food security, transportation, job training, and those kinds of things. And it fits nicely within the waiver concept that the state's putting in. So we're anticipating that in that campus that we'll have a density of social services there around our building, with the idea being that if we could have an influence in some of those areas, we could have a dramatic impact on health status down the road, because those are the things that really affect people's health. It's not so much the clinical care they receive.
So you're hoping it's sort of a one-stop shop in the West Louisville area for residents who need different types of care.
Exactly.
Okay.
And then the downstream benefit of that for the West Louisville community is just the significance of the investment there. You can imagine with Brown-Forman nearby, the new YMCA going in with our campus 5 years from now, that location will be teeming with people. They're going to be eating lunch every day. The folks will want to live close by. There's a redevelopment going on in the Russell neighborhood that sort of ties into it. I mean, you could see a very transformed area 5 years hence.
Talking with Mark Carter, who's the president and CEO of Passport Health Plan, which is a Medicaid, I don't know, what do you call yourself?
Oh, we call ourselves a managed care plan.
A managed care plan, nonprofit.
Nonprofit.
A nonprofit managed care plan for about 300,000 Kentuckians, many of them right here in the Louisville area. And UofL has signed, I think, some memorandums of agreement to move into the building with you.
They
right?
sure have. And, we're anticipating having a significant educational presence there led by the university. It'll initially start out with the community engagement function and the signature partnership that they have. They'll relocate to that building. And then we're working with Dr. Blakely in the School of Public Health, who is working with other deans to try to put together a multidisciplinary presence that will be there in the building. The building will have signage for the university on it. It'll be and frankly, Mark, without the support of the university, there's no way we would have been able to pull something like that off. It's when you think about it, moving to that location is really counterintuitive, and I think it takes folks with some broad thinking and open minds to really embrace a project like that and make it happen. And so the university's been critical to that.
And I think too, kudos to Passport, because you had the Walmart fell through in West Louisville, you had the food port fell through in West Louisville, so there were a lot of negative news coming out of West Louisville that there was some hope for some economic development. Then Passport announces, hey, we're going to build this big building and bring our headquarters down to the site of the old Philip Morris plant there on Broadway. So it's a pretty big deal, not just for you, but for the city as a whole.
Yeah, and I don't know if you've heard the story, but the Walmart, the failure of the Walmart followed up around the same time. There was a shooting at Shawnee Park at the Juice Bowl.
I remember that.
And Kevin Cosby wrote an op-ed that ran in the paper that was titled "West Louisville Needs Some Wins." His op-ed was really about education, but he had a paragraph in there that I read that kind of spoke to me, that was essentially the inspiration for that. So it was really the failure of the Walmart some of the other public events that happened then and then the inspiration from this op-ed that led to the idea. So, and I think in the end, while the Walmart was needed and would bring jobs and retail to the West End, I think our project will have a far more positive impact for people who live in that community. There'll be job opportunities to start businesses like restaurants and the like that, I'm not sure would have happened with the type of jobs Walmart would have brought there.
What's the biggest challenge facing Passport over the next, say, 2 years?
I think the biggest challenge facing us is the uncertainty in our political environment. It's been really hard to, think out 3 to 5 years with the way policy has whipsawed over the last few years. So for us, it's hopefully some of this will settle out over the next couple of years, and we'll be able to look a little further down the road in our planning. And, that's where our opportunity is to really have a positive impact on folks.
Final words of wisdom?
We're excited about our opportunity, and we, I love being part of the university community as part of Passport, and I hope we are for many years to come.
Hope so, too. All right. Mark Carter, always good to talk to you, buddy. As you know, some kids have challenging behavior, and for years, doctors, teachers, social workers, and parents have tried to figure out ways to get their kids to act appropriately. Andy Frye is a professor and researcher in the Kent School of Social Work who's been doing ongoing research on kids that have developmental and challenging behavior difficulties. So, Andy, good to see you again.
Good to see you again.
All right, you've got a couple of studies, and you specialize in these kids that have ADHD and some behavior problems. Why don't you talk a little bit about your studies in general, and then we'll talk more specifics.
Absolutely. So, our studies are targeted towards kids who are at risk for school failure because they struggle in the early grade settings, the ones that we do a lot of work in preschool, which is, I think, what we're focusing on here today. And those challenges can take on a number of different forms, but most generally they either struggle to get along with other peers or they struggle to get along with teachers, which mostly means they're not following teacher instructions or the routines that are typically provided for school kids.
So you're a social worker. So how do social workers fit into this?
Well, social workers are, in most systems, a pretty integral part of education teams. Social workers fit in because we specialize in family dynamics and helping families in parenting, and that, of course, plays a part in a lot of the situations that we develop and that we encounter, and maybe a little less for the preschoolers. But as the kids get older, a lot of the kids with behavior problems are also interfacing with other service delivery systems such as child welfare or juvenile justice. And so one of the things that social workers tend to add to teams of people that serve kids with pretty substantial problems is that we're well versed in those systems and can help coordinate and understand what all the pieces are doing.
All right. Talking with Andy Frye from the Kent School of Social Work. Your studies, you got, $3 million or something like that, right, from the feds?
Correct.
For your first study. Did that include the second study you worked on as well?
No, and then the second one was a very similarly sized and both funded through the U.S. Department of Education. Both focus on an intervention called First Step Next. But there were some differences between those two studies, just kind of advancing what we know from the first to the second.
All right. Well, you finished the first study, and that was on 4-year-olds, correct?
Correct. Yep. Kids that were going to kindergarten the next year, so 4 or 5-year-olds.
And so you looked at how many kids, and were they all in Jefferson County schools?
So we looked at 150 kids over the course of 3 years. And half of those were in Jefferson County schools. We do a lot of partnering with partners over at the University of Oregon and the Oregon Research Institute. And both of these have been multi-site projects. So we coordinate about half of them, and they coordinate about half of them. We're almost always in JCPS. They're not necessarily always in Oregon.
Right, gotcha. And the next, is it called Next Steps? Right?
First Step Next,
First
correct.
Step Next.
Yep.
That's kind of an awkward thing to say as the first step
Yeah.
next. But these were these 4-year-olds, most of them 4-year-olds. What kind of behavioral issues did they have when they showed up for school or for their preschool classes?
Yep. So when they showed up for preschool, they are kids that they can just have attentional problems, right? So they have a hard time sitting in circle time, and so instead of sitting in circle time, they're have their hands on the kids next to them, or they're wandering around looking for activities that might be more exciting than circle time. Those are kind of some of the more subtle issues, but we are looking in each of these studies. We try to find the most challenging child in the classroom. So some classrooms have kids that have more challenging behaviors than that. And so it's not unusual for us to see kids that are verbally and physically aggressive to peers and to teachers and really pose a safety risk, either because they're aggressive or they're runners. They don't stay. It's not just leaving circle time. It's more problematic. Right. They're leaving the classroom, or more problematic yet, running out of the building.
Or hitting kids or those kinds of things.
Yeah, exactly.
And what kind of interventions did your research use to try and figure out what worked and what didn't on these kids?
It's more of a shotgun approach because there's not one particular thing that works all the time. So it has a couple of different components. One is just a direct social skills component. So we're pulling these children outside of the classroom and doing activities that help them to do things like follow directions and stay calm. And we do that by, using, a very short story with some visuals and some characters. And we have a little cue card that has a green on one side and red on another. And so we teach them that becomes a nonverbal prompt. So they know that when it's on green, that's without us telling them they're doing a great job. They know that they're doing a great job. And
it's a visual cue, visual signal.
Visual cue, exactly right. And so then we always start with those social skill instructions to help develop a relationship and help the kid understand what the expectations are in the classroom. But then we move into the classroom component, which is pretty much just good behavioral management. We use that same card within the context of the classroom as a visual cue, and they know that when it's on green, it means they're doing great, and when it gets turned to red, they need to stop and think and get back on track. And they earn reinforcements for the entire class, usually some type of activity. They could, earn
something fun.
Something fun.
If we're grabbing these kids at 4 years old and it works, these interventions work, and I can get them calmed down in the classroom and behaving, and their social behavior is good, what happens when they're in second or third grade? How do we make sure that they still have that good behavior and they retain that? That's the bazillion-dollar question, isn't it?
That's right.
Okay, so that's what you're looking at now.
Yes.
Trying to figure that
yep.
out.
And we think we're making some progress there. And another thing that we're doing in this current study, which is pretty exciting, is we have a pretty comprehensive cost analysis component to it. So we are really tracking all the costs that it takes to implement an intervention. Not just the intervention support, but what do you have to do, before the intervention starts, and what kind of support do you need to provide the interventionist so that they're actually doing it well? And we're laying that out in a fashion that adopters, school districts, administrators, policymakers could use to know, okay, exactly what does it take to do this well, and then we're going to match that up with our outcomes, so you get a cost-benefit analysis, and people can say, all right, if I invest this much money, this is what I should be able to expect on the other end.
Well, that was the other thing, as I recall, when we did that story with you a year or so ago, as I said. You had coaches that were doing a lot of one-on-one work with these kids. That's cost a lot of money for a school system to have. Say you got 10 kids in your school that you want to particularly target. If you have to have 4 or 5 coaches to come in and deal with those kids on a daily basis or every other day or something like that, right?
Yes, absolutely. And so therein is part of the problem. The schools have some people with similar skills, but what I think this is not of JCPS in particular, but really all school mental health services are one of the, I think, reasons they're not as effective as they could be is they tend to do a lot of things,
but none of them well.
But none of them. You said it.
None of them particularly well.
If they did did fewer things that we know worked really, really well, they would probably get better outcomes than if they just kind of did a bunch of things not as well, or just left it up to the individuals in the system to decide what it is that you want to do. There's certainly some benefits to that, but it prevents you from developing a coherent infrastructure to support people to do something very well.
Right. And I think the College of Education, the Kent School of Social Work, the Signature Partnership, all trying to work. Those are U of L entities trying to work with JCPS on doing just that, trying to help them do some things very well.
Absolutely. And we all want the same thing in the end, so it's just a matter of getting on board and agreeing to what those things are, I guess, and who should do them.
All right. Andy Frye, always good to talk to you. Come back when you get the second study done. We'll see if these kids are retaining their good behavior.
That sounds great. I'd love to. Thanks for having me.
All right. Thanks. Andy Frye from the Kent School of Social Work at the University of Louisville. All right. Let's wrap this up with a Did You Know segment from U of L. Did you know that U of L's original School of Public Health was open from 1919 to 1924, making it one of the first schools of public health in the United States? The School of Public Health and Information Sciences, the current Public Health and Information Sciences School, officially reopened in 2002. So that's your little tidbit of trivia about the University of Louisville for today. That'll about do it for this edition of U of L Today with Mark Hebert, which you can hear every Monday and Tuesday night at 6 on 93.9 The Ville, except during college baseball season when it's on Monday and Wednesday nights at 6 on 93.9 The Ville. You can also listen to the podcast of the shows on SoundCloud or watch the programs on Metro TV. Check out all the U of L news, videos, and events at UofLnews.com. Thanks for listening to U of L Today with Mark Hebert, and go Cards!